one thing that came up for us as well, after we went into digital transformation on how we engage our consumers, at the same time, we had spun up a major initiative for moving all of our major technology platforms into public cloud. And so and all of our other web apps as well. And so what we did was a lot of work where we brought in a rock star CTO and chief architect who just knew how to get things into cloud, and not in that mode where you get a lot of people who they take this idea, well, we're going to just kind of cut and paste all of our servers and VMs from our data center into Azure, and we're going to run them the same way. Our guys, Jeff and Matt, they actually had a plan for how do we get there in a way that we integrate how cloud infrastructure functions, and where we run in that infrastructure as code model. And it was really a game changer for us, because we now understood how to leverage consumption models in cloud, and it enabled a lot of great discussions and more focus on how do we do more things, how do we leverage it better, and it really did mature our discussions around security. And so as part of this technology platform, we started building in Microsoft Azure, and the concern for how we secure it, so that whether it's our internal stakeholders using it or our consumers on the patient and health plan member side, we still continue to evolve what we did and what we do with RedShield, and it's definitely a key component that's basically baked in to the solution that we've built for our public cloud technology platform. And we've received some really great attention for what we've built there, especially within Microsoft Healthcare sector, and very proud of what we've done there. But it was definitely a great partnership where the RedShield team worked great with our CTO and our chief architect, because these guys are brilliant guys, and they came in with their own ideas. And I remember talking with Vertus about when they came on board, and they said, well, hey, when are you going to get this going? I said, well, I need to let these guys kind of see the light. And they're smart guys. They're going to get it. And I was very relieved when RedShield met up with our chief architect. They had a great conversation, and Matt, our chief architect, said, hey, RedShield was a good buy, and I'm glad we have that. And definitely worked into a great relationship with what we're building and will continue to build. And whenever I talk to my peers in healthcare, it's interesting. I think that in healthcare, we, in terms of what we do, digital transformation-wise and consumer engagement-wise, I will, grant that a lot of the health systems aren't maybe as aggressive as we have been in building our own stuff, writing all of our own code, putting our own stuff in public cloud. They may rely on other partners, and so maybe through that outsourcing, they don't feel that maybe that gravity on their own hands about security, and so maybe that's But I try to impress upon them the importance of understanding all of these tools, how you better protect web apps and your assets in public cloud, and definitely talk about what we've built and how we've used RedShield whenever I'm able to have those conversations.